Hi, I'm Karen Barno, CEO of Arizona ALFA, and welcome to my video. We are going to start doing more videos and sending that out to our membership. We find that people like to consume videos more than a written constant contact because you can consume it on your own time, and also we'll be posting them to our website behind our member directory, our membership gate. The governor declared a meeting yesterday to talk to the associations about what we're doing, our response in regards to the coronavirus. If needed, the governor can call a state of an emergency. At this point, I think Arizona has 6 cases, but Dr. Chris' fear is that number could multiply, quadruple over the next couple weeks. It's a moving target, so nobody's really sure if we're on the front end or if we're on the back end of this issue. So we're being very cautious. Because assisted living is state-based, the governor has more flexibility on what he can do for us versus nursing homes. Nursing homes, as you know, is a part of, they have CMS, so they don't have kind of the flexibility that we do. Some of the things the governor will be willing to do, and this is not being done now, so please don't think it's being done. It's a possibility. If a community gets hit hard with the coronavirus, or you have caregivers, like on a cruise ship, I think they had 41 crew members sick with it. If you have caregivers sick that you need to send home, first of all, we strongly suggest that you pay them while they're out. I know that can create a financial burden, and I know a lot of caregivers don't have that type of benefit, but we're finding a lot of the large CEOs across the country are backfilling that, make sure their people stay whole. So we would like you to consider that. But what we can do, if it's an emergency, the governor will declare that it will be easy for CNAs to come over and work in assisted living without a certificate. They still will not be able to pass meds, but they'll be able to come and help. Same with the DCW, the direct care worker. We're still writing the rules to allow them to come to assisted living, and that probably won't be official until October. If need be, the governor can do an emergency rules package and have them done in 10 days. So we'll see how he comes up on that, because the DCW is obviously a faster fix. So if we do run into staffing issues, the governor is more than prepared to do what it takes to make sure that we care for our seniors. Also, the best course of action, obviously, is to keep coronavirus out of your building. So we are suggesting that you gate your building. You may take temperatures of everybody coming through your door, and if they have a temperature, ask them not to come through your door. We're seeing a lot more providers are starting to do that, and it is a recommended course of action to make sure that the people coming through your door are healthy, along with taking the temperatures of your staff, all of your staff, whether they're the caregivers, the activity staff, the resident services, your director heads. Make sure that you're monitoring them as well. If you have to close your building down to the outside, or if you choose to close your building down to the outside, before you take that move, make sure that you have iPads, iPhones, whatever it takes, so your residents can communicate with their loved ones. That is extremely important, that we allow them somehow to communicate, whether it's through telephone, whether it's through an iPad. So keep that in mind of how, if you had to do that extreme of a measure, how you'll handle this. It's a good topic for your department head meetings. I mean, everybody carries phones with them, so you could use the phone. Speaking of phones though, make sure you clean your phone, especially within the communities. I would say every hour, because you have your phones with you all the time. And I know a lot of people have, they keep their phones in their purses and locked up. Okay, we know that's what we say. Clean your phones, because you're setting them down all over the place. When you're not at work and you're out, keep your phones clean, because that is one thing that we never think about. We're told not to touch our face, sneeze and cough in the crux of our arm, but we're never told to keep our phones clean. When I heard that last night, I was like, never thought of that one. Also, LabCorp has test kits, so if you need test kits, that's who has them at this moment. We want to know if you have the PPEs. Do you have gowns, gloves, masks? Nursing homes are much more equipped in that area because they deal with a lot more infectious diseases than we do in assisted living. I know a lot of you guys do, but if you don't have gowns, masks, and gloves, please let me know. If you do have them, please also reach out and let me know so we can keep a list of who has what supplies and what's going on, so we need to move them around. The Department of Health Services has found this, well, they knew it, I act like they just discovered it, a stockpile of masks and gloves and that which they're making available out to public health. But keep in mind, everybody is drawing on these supplies. Besides assisted living, besides nursing homes, besides adult care and foster care, you also have the private citizen drawing on these supplies. So be very careful with what you're using. Make sure you use it judiciously. Also keep in mind, some of the lessons that we've learned from the Washington outbreak. Vendors may refuse to come to your building. FedEx in Washington said, no, we're not coming to your building. So the supplies they were waiting for was being taken back to FedEx headquarters. If you're running into that problem, if you have to shut your building down, have an off-site location to have stuff dropped, so you can have shipments dropped so people can come bring you supplies. If they don't want to come up to your building, pick an off-site location. It can be anywhere you choose, just somewhere to have supplies and everything taken care of. Also, we're strongly suggesting, before people go to the emergency room or to go see their doctors, please telemed. A bill was passed last year, which required a lot of the insurance companies to have telemed, so that option should be there for you. One of the doctors that was at the meeting yesterday said that they have waived all of their co-pays. So the caregivers that, $10 is, or $20 or whatever a copay is a lot of money. So a lot of people are waiving that. It's allergy season right now. We're just kicking into allergy season. So a lot of people think they have the coronavirus when really they have allergies, or they're hypersensitive to it because they're older. And as you know, older adults, people with medical compromising issues are at the most extreme risk for this. So we have to be so careful. Team up with telemed. Call them first before you show up on an ER door. If you have any questions at all about coronavirus, please give me a call. Email me. You have my email, kbarno@azalfa.org. We have a direct line to Dr. Chris and also a direct line to the governor's policy advisor. The governor is making this his #1 issue. And although everybody's looking to nursing homes because of the Washington assisted living, we do have a lot of residents in a area versus however many you have in a nursing home, 50, 60 versus a couple hundred. So be very careful. Make sure you wash your hands all the time. Make sure you have the supplies ready. Encourage your caregivers to telemed. If your caregivers feel sick at home, please send them home. Don't have them muscle up and make it through. Send them home. If you can, pay them. If you can't, that's up to y'all. But we want to get through this episode as smoothly, as safely, and not have any residents require catastrophic care or have a very negative outcome. Again, if you have any questions, let me know. We'll be posting this to our member-only site and sending it out in our constant contact to everybody so they kind of get a feel for this. Let me know your comments and questions. Otherwise, have a great day, you guys. We're going to get through this. Talk to you later. Bye-bye.